Hello, I guess we will get things started. I want to say welcome and thank you for joining us for Alcohol Policy in Canada, a webinar series exploring the current state of alcohol policy, public health, and cancer prevention. This webinar series has been organized and presented by the Canadian Partnership Against Cancer, the Canadian Public Health Association, the Canadian Centre on Substance Use and Addictions, and the Canadian Cancer Society. My name is Jennifer Reynolds. I work as a knowledge broker at the Canadian Centre on Substance Use and Addictions, and I am pleased to be your facilitator for today's session. Next slide, please. So the COVID-19 pandemic response has brought about significant changes in many areas, including alcohol policies, consumption trends, and harms. Because of this, there was a desire to convene professionals and thought leaders in the areas of alcohol policy, public health, and cancer prevention to discuss the current state of alcohol in Canada and policy recommendations. The purpose of this webinar series is to renew discussions concerning the regulation of alcohol consumption in Canada. Next slide, perfect. Today's webinar is the third of 4 being offered this fall. The webinar on October 20th discussed alcohol and cancer. On October 27th, we discussed alcohol consumption, costs, and harms. Today, we will discuss public health communication approaches to alcohol. And November 10th, we'll discuss alcohol policy actions. Perfect. Some housekeeping tips just to get us started. All participants have been muted. Please use the Q&A feature to pose questions at any time during the presentations. We have a moderator on hand who will be organizing these for us, and you'll all have a chance to get through these questions during the discussion periods. This meeting is being recorded. All PowerPoint materials and webinar recordings will be housed on CPHA's YouTube channel, and all registrants will receive an email notification when they become available. If you are experiencing technical difficulties, including audio, or are not able to see the slides, please either use the chat function or email webinars@cpha.ca. If you're having issues hearing in Zoom, feel free to hang up and join via the phone. Next slide, please. We respectfully acknowledge that the City of Ottawa and the offices of the Canadian Centre on Substance Use and Addiction are located on the traditional unceded territory of the Algonquin and Anishinaabe people. The Anishinaabe Algonquin Nation has been present on and nurture of this land since time memorial. We are grateful to have the opportunity to be present in this territory. We acknowledge the Indigenous peoples as traditional knowledge keepers, and that our greater society benefits from the sharing of Indigenous peoples. Today, each of the regions from which we each gather are home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to be present on these lands. We strive for respectful partnerships with all Indigenous peoples as we search for collective healing and true reconciliation. Next slide. I would like to introduce our speakers and panel members on today's call. First, we have Dr. Catherine Paradis, a senior researcher and policy analyst at the Canadian Centre on Substance Use and Addiction, and one of Canada's leading experts on alcohol. For the past several years, she has led the framework development and implementation of post-secondary education partnership on alcohol harms. Catherine is also one of the experts responsible for producing Canada's 2011 low-risk alcohol drinking guidelines and the updated version by March 2022. Catherine holds a PhD in sociology from the University of Montreal. Dr. Erin Hobin is a senior scientist at Public Health Ontario, a collaborating scientist at the Canadian Institute for Substance Use Addiction, and has a status-only appointment at the University of Toronto. Her research focuses on developing and evaluating population-level interventions for chronic disease prevention, specifically in the area of alcohol control. Erin recently led a high-profile Health Canada-funded alcohol labeling study in the Yukon that is strongly cited in alcohol labeling reports and presentations by the World Health Organizations. I will now turn the webinar over to our first speaker. Please unmute yourself and go ahead.
All right, I can't see the slides, but I guess, there we go. All right. So, bonjour, mon nom est Catherine Paradis, analyste principale recherche et politique au CCDUS. It is my great pleasure today to present at this webinar accompanied by my dear colleague, Erin, one of the world's top scientists on the impacts of labeling alcohol containers. In a few minutes, Erin will share with you the most recent results of her studies on this issue. She will summarize studies suggesting that when it comes to communicating about alcohol, well, you know, labeling is definitely a tool to consider. So labeling is a topic that has been often talked about in recent years. And today, some of you may be aware of that. As we are updating Canada's low-risk alcohol drinking guidelines, the issue of labeling may come to the forefront once again. Indeed, with new guidelines, debate over the potential of labels to increase awareness and knowledge of guidelines is likely to resurface. So hence, before Erin takes the stage, we thought it might be a great opportunity to inform you, or at least to say a few words about the guidelines update. Erin, I'm seeing the slides in presenters mode. I don't know if that's the case for everyone, so maybe just take a few seconds, check with Ben and the rest of the technical team if the view is correct. There we go. All right. Okay, so next slide, please. Next slide. Okay, so the objective of our presentation today is fourfold. So first, as I just mentioned, I'll inform you a little bit about the update of Canada's low-risk alcohol drinking guidelines. Second, we want to highlight some key recommendations related to labeling in Canada and internationally. Third, to share with you results of the most recent systematic review on the impacts of alcohol container labels, especially nutrition label. And finally, to present and discuss with you what these results could mean from a policy perspective and a communication perspective. Next slide, please. So I really hope that every single one of you in attendance today is aware that in Canada, we have low-risk alcohol drinking guidelines. In fact, it was 10 years this month that they were originally published. The original guidelines were developed under the auspices of CCSA by an independent expert working group with members that were drawn from Canadian addiction research agencies. The original guidelines provided Canadians with advice on how to minimize two types of risk. First, the relative long-term risk of serious diseases caused by the consumption of alcohol over a number of years. And then the guidelines also aim to minimize the relative short-term risk of injury or acute illness due to the overconsumption of alcohol on a single occasion. The guidelines also touch on situation and individual circumstances that we know to be particularly risky and for which abstinence or only occasional light intake was advised. For example, women who are pregnant, persons on medication, teenagers, etc. So finally, the guidelines also included tips for safer drinking and definition of a standard drink. The guidelines have really been a significant step to provide consistent information and messaging for minimizing the risk associated with alcohol, and have provided a cornerstone for undertaking a variety of health promotion, prevention, and education initiatives across the country. In fact, when the Public Health Agency of Canada evaluated the guideline, they highlighted that among its strengths were its clear and explicit recommendation, the concrete examples of implementation, as well as knowledge translation and educational material. Next slide, please. So why an update? Why now? There is no clear guidance on when guidelines require updating to ensure they remain current and evidence-based. But typically, an update is recommended when scientists identify new, relevant, and important evidence that has the potential to alter current guidelines. With regards to the low-risk drinking guidelines, several reasons actually justified an updating process. So first, knowledge on and estimates of the relations between different dimensions of alcohol use and particular diseases, disorders, or injuries has been evolving since 2011, with research confirming the importance of alcohol use as a risk factor for an increasing number of diseases, including some types of cancers. Secondly, more than 50% of alcohol attributable cancer deaths in Canada are among former alcohol users or even people drinking within the low-risk drinking guidelines for long-term risk. Canadians using alcohol within the guidelines with weekly limits also account for 65% of hospital stays that are due to unintentional injuries and a substantial percentage of death due to digestive conditions and injuries. So that kind of led some experts to suggest that reducing the burden of disease may require revisiting the guidelines. Third, we also knew that countries like the United Kingdom and Australia, also France, who recently reviewed new evidence on alcohol and health, released updated guidelines with weekly limits that were significantly lower than our original guidelines. And I will come back to that point in a minute. And finally, so there's been a lot of reports, in recent years on the extent to which alcohol use causes social problems for individuals and sometimes for people other than the drinkers themselves. So there was in 2019, so 2 years ago, when we started to discuss the possibility of an update, there certainly was a curiosity among those of us who had been involved in the original guidelines. We were wondering, what would the guidelines look like? What would they be today if, in addition to disease, disorders, and injuries, we also looked at other types of harms like physical, emotional, sexual abuse, and neglect, for example? What would they look like if these were included in the new guidelines? Next slide, please. So the Canadian guidelines did not include an expiration date, but given the aforementioned limitation and in light of the new evidence, in early 2019, CCSA, Health Canada, the Public Health Agency of Canada, and members of the original guidelines working group engaged in discussions about updating the guidelines. And it was in July 2020 that Health Canada confirmed it would provide $1.5 million for CCSA to be responsible for overseeing and facilitating the whole updating process in 21 months. So yes, drum roll, people, that is by March 2022. All parties agreed on the need to include social harms in the guidelines and also to produce tailored recommendations for specific target groups like youth, women, and people with chronic diseases. There was further agreement on the necessity to accompany the guidelines with recommendations for knowledge mobilization. Finally, and this is important, it was agreed that the update process would not start from scratch. There was no need to start from scratch, but actually build on our original guidelines and also on those from the United Kingdom and Australia that were respectively released in 2016 and 2020. Next slide, please. So we don't have time today to go through all the details of the update. And if you'd like to hear more, I invite you to register to CCSA's iOS conference on November 23rd, and during which a whole session will be devoted to the update. But still today, on the topic of public education, we wanted to bring your attention to one particular activity we completed in the course of the update, and that is a nice segue into Erin's part of the presentation. So for the guidelines update, we wanted to obtain indications about what matters the most and what is most useful to people with regards to alcohol, health, and well-being. And therefore, last spring, we held a public consultation to which nearly 5,000 people contributed. And we found some, I wouldn't say surprising, but perhaps some shocking results. So 5,000 people who were interested enough to answer, to participate in a consultation about alcohol. Well, among those people, 62% said they were not aware of Canada's low-risk drinking guidelines. They're interested in the issue and still 62% not aware of the guidelines. Among contributors aware of the guidelines, the second most often cited challenge for not using the guidelines was that they didn't know what a standard drink was. You know, we recommend a certain number of standard drink. They don't know what that is. And when you think about it, you know, I said I was not surprised, but those results are really not surprising, given that the current alcohol labels in Canada do not communicate the alcohol content of beverages in a form that is consistent with the guidelines and the concept of the standard drink. So we're not really surprised about that. Next slide, please. The need for sustained education was also revealed a few years ago in another study that was done in Ontario, and which showed that only 20% of Canadians were aware that alcohol can cause cancer. And that while Canadians, we know that they are increasingly concerned about mental health, 47% did not know that alcohol can cause brain damage or mental illness. People who smoke know the risk. People who use cannabis are exposed to warning about the risk. People who eat too much sugar know what it can lead to. But people who use alcohol, they just don't know. Next slide, please. So finally, before giving the mic to Erin, I'd like to highlight that this situation where people are unaware of basic information or the range and scope of risk posed by alcohol is not unique to Canada. This situation is not unlike that of other countries that recently reviewed their alcohol guidelines and where experts formulated clear knowledge mobilization recommendations. So for example, in France, the group of experts mandated by the Direction Générale de la Santé advised to promote a general health warning that any alcohol use poses health risk, and further recommended to put warning, nutrition, and standard drink labels on all alcohol containers. In the UK, the report to the chief medical officer stated that health warnings and consistent messaging should appear on all alcohol advertising, products, and sponsorship. And finally, in Australia, where the updated guidelines were released last January, pregnancy warning labels are now required, and so is standard drink label. And so on that note, I will pass the mic to Erin.
Thanks so much, Catherine. So why should labels be considered as a public health communication approach? So labels are a unique information-based intervention because consumers can be exposed to key messages at critical points of contact. So whenever they're interacting with the container, whether that's at the point of purchase or at the point of consumption or pour. And research shows that labels are appealing because of their relatively low cost to regulators, their unparalleled reach among consumers, and their higher exposure among high volume consumers. There is a large, well-established evidence base that brightly colored tobacco warning labels that include graphic images or pictograms, a clear message, black and red large text are effective for increasing consumer knowledge of the health risks of smoking, for shifting societal perceptions of the risks of smoking, and even for changing behavior. And Canada is a world leader in designing strong product labels for tobacco, as well as most recently for cannabis. And the objective of this slide is to contrast the packaging in Canada for tobacco and cannabis versus alcohol. Alcohol is exempt from these product labeling regulations in Canada. And given the burden, the health burden caused by alcohol in Canada, there may be an opportunity to strengthen product labeling regulations in Canada. Alcohol is also largely exempt from food labeling legislation in Canada, despite the fact that alcohol is a top 5 source of calories among 19 to 64-year-olds in Canada, as well as in high-income groups in Canada. Also, Canada's new Canadian food guide recommends limiting alcohol consumption, and international evidence consistently shows that consumers are largely unaware of the calories in their alcoholic beverages. Our group was commissioned by Health Canada and CCSA to conduct a systematic review. The primary focus of the systematic review was to review studies, international studies examining the impacts of alcohol container labels with nutrition information. And the secondary focus of the review was to review international studies examining the impacts of alcohol labels with health messages, standard drink information, and drink limit guidelines. And we were looking at the studies, and the key outcomes that we examined included attention to or noticing the labels, changes in knowledge, perceived effectiveness, and consumer acceptance or support for these different types of labels. The label's impacts on consumers' intentions to purchase or consume alcohol, and actual alcohol consumption. So the result of our review found that in terms of the impacts of nutrition labels, calorie information on alcohol containers can improve consumers' ability to accurately estimate calories in alcoholic drinks and in alcohol consumed over the past week. Without this information, consumers largely were unable to accurately estimate calorie information in their alcoholic beverages. And so providing this information was supportive in enabling consumers to accurately estimate calories. We found that the majority of participants support standardized nutrition information on alcohol containers, particularly calorie and ingredients lists. And overall, we found that there was no evidence of an effect on intentions to purchase or consume alcohol or actual consumption. In terms of the studies examining the impacts of labels with a health message, standard drink information, or national drink limit guidelines, we found that these types of labels increased, improved awareness of national drink guidelines in both Canada and the United Kingdom, that these types of labels increased knowledge or were associated with participants' knowledge and beliefs about alcohol-related health risks, including serious yet relatively unknown health risks such as cancer, that the majority of the studies found evidence for that participants supported standardized alcohol labels with a health message, standard drink information, and drink limit guidelines. And the results were mixed when looking at the impact of these types of labels on intentions and actual consumption of alcohol. There was some evidence indicating a null effect, and other evidence found decreases in intentions to purchase or consume, as well as decreases in actual consumption. And the mixed results could largely be attributed to the variation in the types of studies that were included in the review and the way that these outcomes were measured. One of the studies included in the review that I wanted to highlight was the labeling study that was conducted in Whitehorse, Yukon, led by myself and Dr. Tim Stockwell from the University of Victoria. The objective of this study was to measure the effectiveness of evidence-informed alcohol labels that were bright yellow in color, that were relatively large in size, that included large font and pictograms, as well as 3 rotating messages, including a health message. So the first label there, alcohol can cause cancer, including breast and colon cancers. The second rotating message included the low-risk drinking guidelines, or the guidelines for limiting the number of daily drinks for men and for women. And the third label included information about the number of standard drinks in an alcohol container. And we had a standard drink label for standard sizes of wine, beer, and spirits. And We conducted surveys among a longitudinal cohort of adult consumers in Whitehorse and Yellowknife, and we also collected alcohol sales data from the participating governments in Yukon and Northwest Territories. From the longitudinal survey data, the results indicate increased consumer awareness and knowledge of health risks, the number of standard drinks in alcohol containers, and Canada's lowest drinking guidelines in our intervention site compared to our comparison site. And one of the most compelling results, in my opinion, was that we found that this increase in knowledge of the link between alcohol and cancer was associated with stronger support for alcohol pricing policies, such as a minimum unit alcohol pricing policy. And why I found this particularly interesting is because alcohol pricing policies are well established in the literature as being an effective policy approach for reducing per capita alcohol use and harms, yet is very unpopular among the public as well as policymakers. And so what our research was able to suggest is that as the public becomes more informed about the serious risks from alcohol use, the more open they may be to these well-established effective pricing policies. Our results also indicated that the majority of consumers supported alcohol labels. So more than 50% supported labels with a health message, standard drinks, and Canada's lowest drinking guidelines. This slide presents the results using the sales data that we obtained from the Yukon government. So we use the sales data to calculate standard drinks per adult per month. The bottom line in the graph represents standard drinks per adult per month in the one government liquor store in Whitehorse, and the top line represents the standard drinks per month per adult per month in the 5 liquor stores in Yukon outside of Whitehorse. And we received and used this data before the label intervention was implemented in the Whitehorse liquor store and after the intervention was implemented in the Whitehorse liquor store. And the blue bar there represents the intervention period. And using an interrupted time series analyses, our results indicated that an almost 7% decrease in standard drinks per month, per adult per month in Whitehorse relative to the 5 liquor stores in Yukon outside of Whitehorse. And we actually replicated the same analyses using a second separate comparison condition, so Northwest sales in Northwest Territories, and the results were almost identical, which provided us more confidence in the results of these analyses, indicating, an association between the label intervention and a reduction in per capita alcohol use. So just in summary, the results of our systematic reviews suggest that nutrition labels can increase consumer knowledge of calorie content of alcohol. There consistently was strong public support for standardized nutrition labels on alcohol. There was no evidence of an effect on intentions to purchase or consume alcoholic drinks with nutrition information on the label. And there was insufficient evidence as to whether or not nutrition labels on alcohol impact actual alcohol consumption. In terms of the literature focused on labels with a health message, standard drink information, or drink limit guidelines, the evidence suggests that these types of labels can increase consumer awareness and knowledge of these messages, that these enhanced labels are supported by the public, and that the literature suggests either a null effect or potentially a decrease in drinking intentions and actual alcohol consumption. The point of this slide is to really highlight the importance of strong label design. So in terms of label format, label content, and yes, the overall label design. And the fact that different types of alcohol container labels examined in this systematic review should not be perceived as single solutions or substitutes for each other, but as potentially complementary tools which provide distinct information. So depending on what the policy objective is, can really inform what type of label should be considered, again, in terms of the size is what I was missing, the size, the format, as well as the content or messaging on the label. And just finally, to end with some key messages, Catherine raised that consistently the evidence suggests that there's low public awareness of alcohol-related health risks, standard drinks, low-risk drinking guidelines, as well as the calorie content of alcoholic drinks. Scientific evidence demonstrates that well-designed product labels can inform consumer choices and potentially even change behavior. There is an opportunity in Canada to strengthen alcohol container labels and public education to support more informed and lower risk alcohol use. And the scientific evidence from the systematic review, as well as the jurisdictional scans, align with the World Health Organization and National Alcohol Strategy Advisory Committee recommendations requiring alcohol container labels with information about standard drinks, health and safety risks, and nutritional content. Thank you.
Thank you, Erin and Catherine. Very informative presentations. So we're now going to move on to our expert panel portion of the agenda. As mentioned earlier, please feel free to use the Q&A feature to ask questions of the expert panel. We have some already coming in, so I'm just going to go right to them. I think this is probably for Erin. When you say consumers could not accurately estimate calories in alcoholic beverages in the absence of nutritional labeling, did they typically overestimate or underestimate caloric content of alcoholic beverages?
That's a great question. And it really was 50-50 or don't know. So there was a significant proportion of participants in the studies that we reviewed that just simply didn't even attempt a guess at how many calories. I assume because they really just had no idea how many calories are in alcohol. And then in terms of overestimating and underestimating, it really was a split.
Thank you, great. We have another question. Sorry, I've got to. In reference to labeling, do you have a program or posters to teach or pass this message on by doing school presentations?
Oh, sorry, I missed the question. I cut out for a second.
In reference to labeling, do you have a program or posters to teach or pass this message on by doing school presentations?
So we did not have, as part of our study, a school component, but I do think that that is an important point. And leading up to the actual labeling intervention study in Whitehorse, we did conduct several focus groups with the public across Yukon. And one of the points that came up repeatedly in these focus groups was the importance of having consistent messages in the community, in schools. And so I think going forward, as governments are considering labeling interventions, it's not only the label intervention, but it's the label intervention supplemented by, school programs, by community campaigns, perhaps a media campaign that all have consistent messages across these communication channels.
Perfect, thank you. We have a question. Has consideration been given to developing new LRDGs that would apply internationally?
So I guess that one's for me. To my knowledge, no. And one of the reasons might simply be that in order to develop those guidelines, so the methodology that is used by most countries to develop those risk curves, where you look at the level of alcohol, which level of alcohol use is associated with different level of risk, mortality and morbidity. Now, these are country specific. They're based on national data that show, for example, in Canada, that proportion of people who die of mouth cancer, for example. And so to my knowledge, that might be one of the reasons why no attempt has been made so far. That being said, though, when we look at the various countries who have updated their guidelines in recent years, we're starting to see more and more convergence. Going back to the example of UK and Australia, they have a different alcohol unit that we use in Canada, but when we translate that in Canadian standard drink, one country came at about 7.5 standard drink per week, and another one at 8.3. So getting closer there. France was about at the same level also. So there's starting to be some alignment when countries look at their national data.
Perfect, thank you. Are we getting closer to having Health Canada require labels for alcohol? What can the provinces and territories do?
I think that there's a lot of interest from the different levels of government. We have, presented the results of our study as well as the systematic review to different departments within Health Canada. Health Canada funded the labeling study in Yukon. So there's definitely a lot of interest, and we've also had a lot of uptake internationally. The World Health Organization is very interested in this work. So there seems to be some momentum in Canada and internationally. So momentum and interest in enhancing alcohol labels. In terms of what can be done at the provincial, territorial, and national levels, this is not my area of expertise in terms of regulations, but my understanding is that the different levels of government do have the authority to consider requiring enhanced labels on alcohol. But traditionally in Canada, this type of regulation has been done at the federal level.
Excellent. Another one, does anyone know if Ireland has actually implemented cancer labels on alcohol? It was supposed to happen in 2018.
So we have actually consulted a number of times with the government in Ireland on their regulations around cancer warnings on alcohol. My understanding is to date that the legislation has been passed but has not been implemented, and the delay in implementation is because of the pushback from industry. So it's very rare that once legislation in Ireland has been passed that it would go to a public consultation, but because of the industry pushback after the legislation was passed, that did happen, and I haven't heard anything further. So to my knowledge, the labels in Ireland have not yet been implemented, but the legislation has been passed.
Okay, moving along. A number of jurisdictions, including the EU, have introduced online nutritional and alcohol awareness messaging through QR code on bottles and marketing materials. Is this practice consistent with your recommended approach?
There are limited, but some studies that have looked at using either QR codes or putting websites on alcohol containers to sort of push consumers who are interested in more information to follow up. This has also been done on food packages, and the studies that have evaluated this approach have essentially found about 1% or less of consumers actually follow through and go to the websites and look at the information, which I really think suggests the bottom line is if having consumers, be aware of the health risks or be aware of these key messages, the information needs to be easily accessible. It needs to be clear, and it needs to be, you know, at the point of purchase, at the point of pour on the container. The more effort that's required in order to seek out this information, the more people we're going to lose and not get the information across.
We have another one. Will there be LRDGs for seniors?
Actually, some were released a couple of years ago. I think my colleague and co-chair Peter Butt, who was responsible for those, is on the line today. But yeah, we do have guidelines for all older adults. They are available on CCSA's website and on the Canadian Coalition for Seniors Mental Health, just to name these two. And currently, what are the recommended drinking limits for adults over the age of 65? For women, it's no more than 1 standard drink per day with no more than 5 per week. And for men, it's no more than 1 or 2 per day with no more than 7 per week.
Great. Are the results of the consultation from the public for the LRDGs available on the web?
It is on our website, on CCSA's website. If you go on the LRDG 2022 tab, there's a sub tab that says documents produced to date, I think something like that. And the summary results of the public consultation are available there in French and English.
Perfect. What's your interpretation of the finding, from some studies at least, that label interventions don't influence intention to purchase or actual consumption of alcohol? How should these findings inform policy?
So the labeling literature, really varies in terms of the approaches taken to assess the efficacy and effectiveness of alcohol labels, also to the design of the labels. So I think that's a very important point, and I tried to emphasize that in the slide presentation. So there, in the US, there was federal legislation passed in 1989 to require warnings on alcohol containers. However, the warning in the US is all text. There isn't specific regulations around the size of the text or the color of the text. And the message is somewhat vague. So it cautions about drinking when pregnant, drinking when driving or operating machinery, and the link between alcohol and general health effects. So the point, and the evaluations of the US warning labels showed that over about 4 years, almost 50% of the population said that they had seen the labels, but there was very limited, if any, impact on actual consumption. And the experts that conducted this evaluation, really sort of associated this lack of connection between the labels and behavior change to the weak design of the labels. So I think the variation across the results of the different labeling studies really comes down to how the study was conducted, the outcomes were measured, and the design of the label. Is the label designed according to best practice principles for effective product warnings?
Perfect, thank you. We got some more coming in. It has been well known for decades that alcohol is both teratogenic and onconogenic, but we do not have warning labels on this product. Clearly, the alcohol industry lobby has a strange hold on government. What will it take to address this significant public health issue? Are there lessons to be learned from dealing with the tobacco industry?
Erin, you want to take that one, or I mean, I can just start to respond. Neither Erin nor I are policymakers. We're not the one, that decide or not whether a certain policy is implemented or an actual law being amended or so on. So I mean, the question is more direct to that government. I feel they would be the one able to respond to your question as to how they deal with this type of lobbying. We know it exists, but besides that, I don't think I can say much.
Moving on. Do we know if any groups are currently trying to advance effective alcohol warning labels modeled after the Yukon study, perhaps both within and outside of government? If not, what are your thoughts on how we make this happen by mobilizing interest across provinces and territories? This seems more challenging in the absence of an alcohol advocacy group free from industry conflict of interest.
I know that there are a number of different jurisdictions that are interested in alcohol labels. After our results were published, we were contacted by different governments across the country to meet with them and to discuss the results. As to a group that's working on similar labels, I don't know of any. To my knowledge anyway, in Canada. I do think it will be interesting to see if and when Ireland is able to implement cancer warnings on alcohol and what those warnings look like and how close the design of the label is to best practice principles for effective labels, or if they're more like the US warning that was sort of a text only, very sort of ambiguous label. I don't know, Catherine, if you know of any other groups that are working on labeling.
Not to my knowledge, no.
Okay, thank you. Hasn't the Yukon removed their warning labels, or have I misunderstood this?
So Yukon and Northwest Territories are actually the only two jurisdictions in Canada that have been applying post-manufactured labels to alcohol containers for the past 30 years. The label, though, cautions about drinking when pregnant in both Yukon and Northwest Territories, and then the label in Northwest Territories includes additional messages about drinking when driving or operating machinery and general health concerns, so similar to the US label. My understanding is that after the intervention was over, the intervention labels were not necessarily removed from any of the containers in the White Horse liquor store, but they did they went back to applying the older label.
Thank you. Can you talk about the role of the alcohol industry in influencing alcohol policy?
I think it goes back to what I said previously. I mean, we do know that there is lobbying. Everyone is welcome to go on the Office of the Commissioner of Lobbying of Canada website, and there it's possible to look at the activity done by various groups. However, when it comes to their impact, again, that would be a question to be asked to government and to policymakers.
The only other thing I might add is going into the Yukon labeling study, I definitely was naive. It was eye-opening just to learn of the sort of strong response from the industry when we launched our label intervention in Yukon. And Tim Stockwell actually published a study in the Journal for Studies on Alcohol and Drugs outlining the industry challenges to our labeling study. And we worked with Robert Solomon, who is a public health lawyer, and his response and sort of rebuttal to all of the challenges that the industry made to our labeling study. Just as an example, based on quotes that the industry made in the media, one of their biggest challenges is the relationship between alcohol and cancer. They didn't feel that there's enough evidence for this relationship between alcohol and cancer, despite the fact that the International Agency for Research on Cancer has listed alcohol as a group 1 carcinogen for the past 30 years. So they challenged that evidence. They also challenged the effectiveness of putting labels on alcohol containers, despite the fact that the main purpose of the study was to, to examine if putting labels on alcohol containers is an effective strategy for communicating health messages to consumers. So those were two of the biggest challenges the industry made during our label intervention study.
We have some more. The United States recently updated their drinking guidelines. Are the US guidelines being evaluated or considered for purposes of the Canadian LRDGs?
So the short answer is no. The reason being, at the moment where the mandate was given to us, they were not released. The United States had not released yet their updated guidelines. So as I mentioned, we have been asked to build on the work of our original guidelines, the ones produced by United Kingdom and Australia, which all did an amazing job at really describing all the various steps and all the studies they've used. So it's easy for us to follow their tracks and build on the work they've done. And I would just like, while I have the mic, because I see my co-chair Peter Vatu in the chat box added a point of information regarding the low-risk drinking guidelines for older adults, the question I was asked earlier. So he's saying that the recommendation is to decrease to 50% of the guidelines at age 65 or sooner if health warrants, with further tapering off as age and frailty progresses. If the low-risk drinking guidelines are lowered, the 50% decrease still applies. So a point of clarification. Thank you, Peter.
Okay. Is there any precedent for plain packaging of alcohol similar to tobacco and cannabis?
So there have been some small randomized controlled trials testing the efficacy of plain packaging on alcohol containers, and similar to, you know, the studies looking at plain packaging for tobacco or cannabis. Removing sort of the attractive packaging on alcohol definitely has an influence on consumers' perceptions of the product, the product's risk, and their intentions of consuming. So again, the alcohol literature looking at plain packaging is a lot smaller than the tobacco literature, but the studies are there, and the increase in alcohol studies looking at labeling, plain packaging, sort of elements of alcohol containers overall has definitely grown in the last 3 years.
It is increasingly difficult to purchase a standard drink according to definition. For example, beer is often sold in 500 milliliter servings over 5%, and red wine almost always contains more than 12% alcohol. Is there a possibility of redefining standard or providing additional examples to help support understanding?
Yeah, that's definitely a growing phenomenon, especially with the microbreweries and micro distillery phenomenon, where we see a wide range of alcohol content in a wide range of size when it comes to alcohol containers also. So yes, it is increasingly difficult to know what is a standard drink. Now in Canada, currently a standard drink is 13.45 grams of alcohol or 17.05 millimeters of ethanol. Most, according to WHO, most high-income countries have 10 grams. Now, changing the number of grams would not make it easier for consumers in any way. And that's why one of the options when it comes to communicating rightly what people are consuming, one option on the table would be labeling. So it's fine. It's, you know, for consumers to have many products to choose from, but when they take a beer, they should know whether that contains the equivalent of one standard drink or 2 or 3. We've seen products that in one container, it's all the way up to 4, the equivalent of 4 standard drinks. So it's really just at the point of pour, letting the consumer know what they are consuming. People have a right to know. It just makes perfect sense to me.
Just following up on Catherine's comments, the literature also very consistently shows that having % alcohol by volume on alcohol containers alone is inconsistent, one, with the units used in the low-risk drinking guidelines, and makes it very difficult for consumers to estimate the amount of alcohol in a standard drink and to comply with the low risk drinking guidelines, because alcoholic beverages, like the person who asked the question said, you know, the strength of alcohol varies a great deal across different types of beverages within different beverage categories. And so not having a consistent information on the label in terms of what is a standard drink for that beverage and the number of standard drinks in that container makes it very difficult for consumers to comply with the guidelines.
Okay, will the updated alcohol guidelines take into consideration interactions between alcohol and other substances, as well as prescription medications?
That's not part of our plans, no.
Okay, we have 5 minutes left, so I do see some questions. I'll just scroll up here. Is there anything stopping a group or individual from putting up advertising, example, billboards saying alcohol causes cancer? It's factually accurate. I'm not sure about that one. I guess that's you, Catherine.
Go ahead, Erin.
No, I was just going to say that, you know, there's a really nice example of a health authority in BC who received approval and budget to do a campaign to raise awareness of the link between alcohol and cancer. The campaign launched in January 2020, and it was a really beautiful campaign. It included outdoor advertising on the SkyTrain platforms, on buses, and the tagline was "Now You Know." And it really tried to drive the point home that if you drink alcohol, you increase your risk for cancer. And then it also provided strategies for if you drink, you know, try to drink less, try to have alcohol-free days. And we did work with the health authority to evaluate the sort of the uptake and awareness of this campaign. However, due to COVID, we got derailed a little bit, but it really was a beautiful campaign. And again, it's just an example of a health authority where that was interested and based on their constituents learned that, you know, there was a real desire to have more information about alcohol and the harms caused by alcohol. And so they developed this campaign.
Perfect. Okay, last question. Are there other countries that have an alcohol and cancer label on their products?
So Ireland is working towards a cancer label on alcohol. Also in South Korea, there is legislation requiring a health warning on alcohol containers. However, when this legislation was passed, again, there was a lot of pushback. And so the compromise that the South Korean government made was that the producers can choose between one of 3 health warnings, and only one includes a cancer warning. So they could choose, you know, the other 2 warnings to put on containers instead of the cancer warning. And so other than South Korea and Ireland, I don't know of any countries to date who have been successful in implementing cancer warnings.
Perfect, thank you. So we are going to wrap this up now. Thank you very much, Catherine and Erin, and all the questions and the participation. Just to go back, yeah, there we go. And if we can go to the evaluation slide, perfect. One reminder before we close today's session, you will be redirected automatically to an evaluation survey. So if you could please take the time to complete it, we'd really appreciate it. Your feedback is important to us and it'll help drive improvements for future events. We've timed it, so it should only take about 3 minutes. And the next slide, thank you for attending. So just before we close, I would like to thank our speakers, our expert panel members, all the behind the scenes IT, technical advisors, and our chat moderator, and of course, you, the participants. We trust you found value in today's discussion and will use this information to inform your work. Thank you and have a wonderful day.